dietary changes and drink a
So
lot of
once
olive
you
oil.
develop calcified plaque, it'll be there. The goal will be to keep it stable, keep it from progressing. You already take a statin, I'm assuming? You're already previously on a statin, yeah.
Yeah, and if it doesn't go down, his creatines, by the time they transfer him, what is the next goal? You still do it, or?
We do the diet exposure using the minimum amount of diet possible.
Okay.
We give them IV fluids and IV fluids before and after to allow the body opportunity to flush the dye out as quickly as possible, so there's less time the dye is being exposed to the kidneys. And number three, we make some medication adjustments to make sure none of the medications are actually going to complicate recovery. And then we watch and wait. And if after 48 to 72 hours the kidney function gets worse, then temporarily he goes on dialysis.
Oh, okay.
And so we see some signs of recovery, and then we take him off when we can. But even like when you have kidney disease, the process of just having chronic kidney disease is an inflammatory exposure to all of your blood vessels.
Okay.
And inflammation in blood vessels leads to scarring. Scarring leads to calcium. Right.
Okay.
And so when a scar tissue organizes, it organizes by way of calcium.
Okay.
And so he, even though he had the pancreas transplant and he's not on insulin and his diabetes is okay, just by virtue of having kidney disease and by virtue of having another organ, two organs, in your body, your immune system is revved up, right? And that inflammation cascade eventually leads to what we're talking about with the heart,
Okay.
And so even though he's been a good citizen of the world and doing all those things, but just having two separate organs creates a momentum for inflammation. And that inflammation, is throughout your body. And so, it can lead to coronary artery disease. It can lead to calcified plaques that are harder. And as Dr. was suggesting, like because of the host of being a kidney patient, there is a greater risk of having harder plaques because of the greater inflammation, more scar tissue, more calcium. And so that's why they have to use the technology that's appropriate for that.
Okay.
Yeah.
Yeah.
Okay.
Yeah. No, actually, I'd like it to just gone smoothly. But
Yeah.
But it is what it is.
Yeah.
I know.
And he
I don't live
understands.
in a fantasy
I mean,
world.
he used to be a registered nurse, so
I don't live in a
he
fantasy land.
he worked at the University of Chicago when he got the transplant.
I see.
So
wow.
he recovered with his coworkers
I
were
see.
helping him.
That's awesome.
What
So-
department were you working in? What?
At the time, I was floating between the
Telemetry.
neurologic ICU and the
And
surgical
ICU.
transplant.
I see.
Oh,
Gotcha.
So I would work on the
Oh, you
surgical
were
transplant.
already
2 days
surgical
later, having my
transplant.
transplant.
Yeah.
Got it.
Yes, he was a-
Anytime this guy's on my patients, I'm extra vigilant. I'm
Really?
ready.
Well, that's good. I gotta give it to you after all this.
We're a team. We work together.
I'm so glad.
I think
Yeah.
the bottom line is like
Yeah.
honestly, like this is the man right here. Like
Yeah.
he loves to deflect.
Yeah.
Yeah. And say everyone else is great. He's one of the best doctors I know
Oh,
here.
really?
So you're in
Oh.
very good hands. As
Well,
far
I'm
as
so
cardiology, I
glad.
wouldn't have any of my
Yeah.
family under his care.
Oh, well, that's good.
100%.
Like, I'm gonna have to steal and go to Hinsdale.
I know. Well, thank you so much.
Yeah,
I've been wanting to talk to you guys, but it's been like I've been missing you guys.
Oh, good. I'm glad
that's
you
why
were
when
here.
you came in, I was like, "Don't leave!
No, I'm not
I'm ready to
worried.
talk."
Yeah.
So thank you
Yeah,
so much.
I don't care where it gets done.
Yeah.
Okay.
Just that, obviously, I wouldn't like to be on dialysis, but
Yeah.
Yeah.
again,
I know.
I'm a
But
realist,
listen,
I
the
understand.
heart's the biggest thing, right?
Yeah,
And so we
but
got to
when
make
you
sure
come
that's
in at a
protected.
2.0 creatinine,
Yeah.
I've been there
Yeah.
for a year now.
Yeah.
And his partners are things there too, so it's
Yeah.
a nice
Oh,
continuous
good.
care.
Team.
Good. That's awesome. That's perfect,
Maybe
man.
in the interim we'll find a heart with an A positive blood type.
Yeah.
Just slap that in. We're good to go.
Okay.
That sounds